Welcome to the Care Right podcast, your go-to resource for all things elder care. Guiding us through this journey is Annalee Kruger, the founder of Care Right Incorporated, and she has been steadfastly supporting families across the United States. Each episode brings you expert insights, innovative strategies, and practical advice, ensuring that you're well equipped to provide the best possible care for your loved ones. Expect to gain valuable knowledge, learn from real-life stories, and get inspired to take action in your own caregiving journey. So buckle up as we dive into an in-depth discussion of elder care planning and together embrace the journey of caring for aging loved ones on the Care Right podcast.
All right, welcome back to Something More with Chris Boyd for the second hour of the program. Thanks for being with us today. And for this hour, as I said previously, we're going to be continuing the notion of talking about long-term care issues. Coming up shortly, we're going to be talking with Annalee Kruger. Her company is called Care Right, and she is just a wealth of great information. And we'll talk a little bit about planning for senior care and just all that involves. Before we do, I don't think I mentioned this earlier. Something caught my ear. I was listening to a podcast, and they mentioned some figures that I wanted to just share with you guys. We spent a lot of money in the last year when it comes to the CARES Act and all that we spent. I came across this. They said our fiscal year, for the government ends September 30th, whatever the end of the quarter. And so now they've released some numbers. Our annual deficit for the last fiscal year for the government was $3.1 trillion. Now, a lot of that is because of the coronavirus, and we've put extra expense into our midst to try to mitigate some of the impact of the virus. But that means that we are now carrying an extra, the national debt, $21 trillion. Higher as a percentage of GDP than at any time since the immediate aftermath of World War II. And, it's still likely to rise, of course, because, either side, we're talking about some additional stimulus because the needs are still high and the coronavirus has not gone away. And there's a lot of people unemployed, and there's certain industries that are definitely adversely impacted by it. So it remains an issue, and I think what we're going to see as a consequence of this is sort of a rude awakening, as much as it's a necessity, perhaps, at the present time to mitigate the challenges that we don't want people in, food lines. We don't want people out on the streets. There's a need, and we want to be attentive to that, but it's not typically a comfortable way to think about the use of funds and this excessive spending beyond our means. And so I do think we're likely to see a renewed interest in fiscal responsibility in the years ahead, though probably not immediately. So, and when you think about it, we are sort of pulling forward economic benefit that ultimately future generations will have as a cost. So something to give thought to and something we'll talk about, I'm sure, again in the future. I just wanted to remember to share that. All right. Well, I've got Annalee Kruger, and she is the founder and president of Care Right, and senior planning is her area of expertise. She's a course teacher on a class I'm taking right now, which I really am enjoying. And so I'm glad to have you with me, Annalee. Thanks for being with us on the show.
Thank you, Chris, for having me.
All right. So, lots to talk about. I wanted to start off with, the kind of work that you do. I find it difficult to label. What's the term of art or, in the industry or whatever? I think is it social work? Well, it's not really social worker, but it's kind of like that in a sense where you're really helping people navigate things. Plan of care kind of coordinator, okay, maybe so. If people are looking for like, who do I get help in these kind of, maybe you can elaborate. What are the circumstances that people tend to find themselves in need of help and the right phrasing of this kind of service?
Right. So most of the time, actually 92% of the time, families come to me in crisis. The challenge with the phrasing or the terminology, I call what I do an aging plan. I consider myself a geriatric family consultant. So I work with families across the country. If families are looking for a variation of what I do, they would want to look for like a geriatric case manager. What I want, since we're on this topic right now, you just have to be cautious, because there's not a lot of people that are doing what I do. And I can say that as a fact, because that's why my business insurance is so very expensive. So, because I don't fit into any other category, right? Yeah. So I kind of was a pioneer with my business model when I started it. So when you're looking at, okay, I'm in a predicament, I'll just walk you through a
typical kind of case study.
An example. They're all variations of the same thing, but families find themselves in a predicament, right? So let's just talk about, we've got mom and dad. Dad's the caregiver of mom. She has dementia. She needs 24-hour supervision because of her, brain disease is shrinking her brain. So she has mood, behavior, and personality changes. She wanders, she gets more upset in the afternoon, she gets her days and nights mixed up. So she clearly needs 24-hour care and supervision, right?
Okay, yep.
You couldn't leave her alone and trust that she's going to take her medications. You couldn't leave her alone and trust that she's not going to burn the house down because she left the stove on. You can't trust that she's not going to put a frying pan in the microwave because she just doesn't put things together in her mind anymore, right? So
and that could be exhausting, just if it's like you're saying, describing it 24/7. That's got to be so demanding.
Exhausting.
Yeah.
It's horribly exhausting. So you got mom with those kind of care needs. You've got dad, who's the primary caregiver. When you're looking at, the generation that I work with, the 70s, 80s, 90s, and 100s, they took those vows seriously. And what I mean by that is they don't want to reach out for help, because they think that if they have someone else helping them, they're not fulfilling their vows. Mm-hmm. Right? It's just a thing that
feel an obligation.
They feel obligated, right? And so then
even when they might be benefited by getting some help in the process, they feel like it's private, it's internal, family matter, that kind of thing.
That's right. That's exactly right. And so they don't necessarily tell the kids, hey, just so you know, I haven't slept for 4 days, or I haven't been able to shower for 2 weeks because I can't take my eyes off your mother. They don't share that stuff openly. And so what happens is, usually what happens is the primary caregiver, in this example, the father, the husband, ends up so utterly burned out because you can't sleep if you can't get a full night's sleep. If you're listening to this podcast and you notice that there's a weight loss in one of your parents, or both of your parents for that matter, but if you notice a weight loss, your parents just don't look like they're sleeping or they're healthy, they're irritable, they're depressed, they're more confused than usual, those should be red flags to you as adult kids to say, hey, let's explore this. Something's not right. Because what happens, unfortunately, is dad ends up getting so exhausted and burned out. He's not getting his doctor's appointments. He's not getting to them because what's he supposed to do with his wife? She can't be alone, right? And now at this point, her behaviors might be a little bit embarrassing to him in public. And so he doesn't go to his doctor's appointments. So he actually jeopardizes his own health to be able to be the caregiver to his wife. Okay. So then what happens is dad will end up having...
Just as a side, and this could be not just mom and dad, it could be mom and child, who's the caregiver, or whoever it might, whoever happens to be in that example, the caregiver.
That's right. You're right. Absolutely. And so then you have dad who hasn't been sleeping. He's not getting to his doctor's appointments. He ends up having a stroke, because this is actually exactly what happened to my parents.
Oh, okay? Wow.
So we're just using my parents' example. And so dad ended up having a stroke. And thankfully, it was a mild stroke, but it was a wake-up call for him to say, okay, look, I need to allow help. I need to allow help to come in, because that's different than asking for help.
Yes.
Right?
Yes.
And so what happens is the kids all fly home or whatever the situation is. And then they're like totally blindsided by like, oh my gosh, we had no idea that my mom was so confused. Because if you talk to her on the phone for 10 or 15 minutes, they can cover pretty well.
Yeah.
But it's when you're there that you're like, holy smokes, how does dad do this? Right. And then you've got the whole, like, not only physical care of making sure that mom makes it to the bathroom and make sure that her laundry's done and make sure that she's got her food and her medications. But then there's that whole care coordination piece where you have to call doctors and get them into their doctor's appointments and then figure out how you're supposed to juggle that with other things too. So these are typical crisis scenarios. Is the kids end up, now in this part of the example, none of us were blindsided. Like we knew. That's why I kept flying up every 4 weeks so that I could help take care of my mom. But in most cases, families are blindsided by how awful their parents really are.
And I'm sure even when you're attuned to it, it still can escalate. And, it's a circumstance that's ever changing, right?
Yeah, because so good segue, because it escalates very quickly when in this case your mother has a urinary tract infection. That throws them off. They get more confused, lethargic, agitated. They are at a higher risk of falling. They're very difficult to redirect, and it's because they have an infection and they can't say, oh, it hurts when I pee, or oh, my back hurts, or
right.
They can't share those typical symptoms that if you or I had a urinary tract infection. And I only bring up a urinary tract infection because it is so prevalent. It's one of the leading causes that brings people to the ER, and dehydration.
Yeah, and it can create disorientation on and of itself,
Very
right?
much.
Yeah.
Very much. And so some people are like, oh my gosh, it's like mom got dementia overnight. And I'm like, no. She probably has a urinary tract infection, or maybe there's something off with her blood work. I mean, these are all things called delirium. And what's good about delirium is that they are treatable and preventable. So it's just that it exasperates the dementia. It just blows it up even more or even worse. So these crisis scenarios.
Some of those symptoms could subside with the reduction in that infection in that example.
That's right. That's right.
Okay.
Yep. And so, but there's a lot of adult children that don't understand the true impact, significant impact that a urinary tract infection can cause. So that's why I bring it up, because people they're always blindsided by like, oh my gosh, I didn't know an infection could cause such havoc with my mother. Well, it does.
All right.
Or
So
father.
you've kind of painted a picture here, sharing some of your own family experience, but one that people can relate to that, could be happening for lots of people. And so the challenges of one caregiver maybe starting to not take care of themselves and ultimately getting, drained in the process. And so now how does a firm like yours fit into the process of how do we bring some additional help into the process?
Yeah. So what I do is I work with families across the country. They seek me out. I don't advertise. I've built my business off of word of mouth referrals and doing a lot of these types of podcasts and those kind of things, and speaking engagements and training. And so people seek me out because they're in a crisis. They realize that the situation or the predicament that they're in is not sustainable. If we go back to the example I gave with dad having a stroke and mom is at home and dad's in the hospital, the kids fly home. And then that's when they realize how demented their mother is. Right. Mm-hmm. And so they're like trying to be with their dad at the hospital, but we can't leave mom alone. And so now what are our options? Mom needs care. So these are the predicaments that families come to me. I develop what I call an aging plan. That's what I call it.
Yeah.
Other people like in the industry, they would call it like, a care plan, but the difference is that mine are comprehensive. Mine are not just a one sheet checkbox. And that's what you're going to find if you Google like geriatric care managers. And the beef, I guess, for lack of better words, I probably just dated myself, but the beef I have with the way that things are done now for seniors is that the professionals that are trying to do these care plans, they they don't always know to ask questions beyond what the computer tells them to
It's
ask.
not necessarily sufficiently custom. It's not sufficiently
Correct.
tailored
It's
to
just
the unique
field
circumstances of a given family. And you're saying
Right.
it's really important to have that comprehensive understanding of the possibilities and knowing where to probe and how to ask for more
That's right.
information. Yeah.
And having the critical thinking skills to say, oh, what brings those tears? Tell me about what you're thinking that's causing those tears. Unfortunately, the way that healthcare is going, it's just so automated that the only questions you're going to be asked are what's on the questionnaire. There's not going to be anything beyond that, and that's just not sufficient.
Right.
So I call it an aging plan, and what that involves is I find out it's a fair amount of what I call discovery. So it's interviews with the family members. What's working well, what's not working well. Well, in this example, clearly what's not working well is dad's losing weight. Mom's confusion is worse. Dad's not taking care of himself, and he needs help and support. He needs a good night's sleep. He needs to right? He needs to be able to shower without worrying about, did mom just wander out did she just wander out the door? So I find out what's working well, what's not working well. And what's not working well, it's always variations of the same thing, but it's caregiver burnout, whether it's the spouse or the adult daughter or adult son who continually misses work to try to come to the rescue every time there's a problem. It's family relationship strain, where it's because of everybody has a different relationship with their parents, right? I have siblings. We all have a different relationship with our parents. We have a different relationship with each other. So as family dynamics are an issue, caregiver burnout, and other things like just dementia progression. Dad's not moving, dad's not walking around the house because he lives alone. And so therefore he's not drinking and eating properly. Right. So it's a variation of all sorts of problems.
Let's take a break and let's come back and elaborate on how do you then, help to solve those problems with the plan that you create. We'll be right back after a quick commercial break. Stay with us.
Do you have a professional doing your payroll? If not, you should consider Capital Payroll Systems because they are the professionals. Capital Payroll Systems is the dependable service that provides accurate information and timely service. Capital Payroll is the worry-free service that provides total tax filing and new hire reporting. And Capital Payroll Systems is the personalized service that continually offers unmatched customer assistance and time-saving solutions.
Hi, this is Chris Boyd of Asset Management Resources. We're thrilled with the professionals of Capital Payroll Systems because they make my life easy. I don't have to worry about deadlines or filings and fines. I just talk to Pam or Linda and Terry, and they do all the work. Simplify your life. Talk to Capital Payroll Systems. They are the professionals.
So if you're not using the professionals, call them toll free at 800-298-0008. That's 800-298-0008. Or visit them at capitalpayroll.com. You'll be very glad you did.
If you're an out-of-state resident, but you own real estate here in Massachusetts, you need help to avoid the Massachusetts estate tax. I'm Keats Boyd of Boyd & Boyd PC in Hyannis. The laws and regulations governing estates are complex, so out-of-state residents need a local expert to protect their family. Proper estate planning can save your family thousands of dollars. We can help. Call my office today or visit our website for a free estate plan report. Boyd & Boyd PC. Let our family help your family.
Stand by for an important message from Steve Exaros.
Hi, I'm Steve Exaros. When I was Deputy Police Chief, I made your family's safety my job every day. As your next state rep, I'll continue to enforce law and order. My experience uniquely qualifies me to support first responders, keep violent criminals and drug dealers in jail, and oppose dangerous policies like sanctuary cities. I'll also be a voice against taxes, tolls, and reckless spending. Beacon Hill politicians don't need more money. You do. Let's get Cape Cod small businesses back to work and kids back to school safely. And as a Gold Star father, I'll always support our veterans and military families. I respectfully ask you to vote for me, Steve Exaros, for state rep. Thank you.
Please join me in voting for Stephen Exaros on Tuesday, November 3rd. Paid for by the committee to elect Stephen Exaros.
I thought love was only true in fairy tales.
All right, welcome back to Something More with Chris Boyd. I'm here talking with Annalee Kruger. Her company is Care Right Inc., and you can find it on the internet, carerightinc.com. And we're talking about the challenges of planning for seniors with aging, an aging plan. And Annalee was just elaborating some of the dynamics of very common kinds of circumstances that people run into with the just burnout from the providing care for someone who may need it, and then how do we begin to sort of plan around that? And so, Annalee, so now you've had the family involved. There's an awareness of a problem. How do you begin, and maybe a crisis, as you referred to it? How do you begin to sort of help them navigate where to go, what to do, who to bring in, or, what level of care is appropriate?
That's right. And so through the course of an assessment or discovery, I find out what are the goals. Most seniors want to age in place at home. Well, that's fine, but then what do we have for financial resources to be able to support that? I have clients that are paying $20,000 a month in home care to be able to stay at home because they don't want to go into assisted living. Or
that may not always be the most cost-effective, although more often than not, initially it is, but there may be times at which it's worth considering alternatives.
Right. And so I help educate. Part of the big piece of what I do is really help educate families so they can make informed decisions. So when families say, well, yeah, we want to be able to age in place at home, I'll say, okay, well, just so you know, here's some things to think about. Here's the pros. Yeah, you can stay at home. That's great. All your things are around you. You're in your own neighborhood. You've got your privacy and all that kind of stuff. But here's the cons to that. The cons are it can be pricey. So it depends on what you have for finances. Elderly people nobody really likes having all this traffic in and out of their house. Yeah. Right. Yeah. So the complaints I get from the clients that I have, because you have to keep in mind, I see all sorts of different situations, right? No family is the same. And so, but what is the same is the complaints that come from those who chose to decide to age in place at home. So they don't like the price tag that often comes to that when it ends up being long-term care that's needed, long-term care that's in the home. Yes. They don't like the traffic of people coming in and out, because if you have home care, you're probably going to have a nurse that comes in as well. You're going to have physical therapy, occupational therapy, and all those other providers coming in, and they really don't like that. But if that's your goal to stay at home, then you have to take the good with the bad, right? They also don't like that a lot of these, and no offense, it's just how it is, but a lot of the home care workers are maybe younger,
minorities, they can,
they don't clean how they don't clean. You're right. They don't clean how mom and dad would clean. They don't get down on their hands and knees and mop. They don't know how to prepare. They don't know how to cook. So
I say that just because different generations react differently to this. When this is frankly, it's labor, right? In many respects, there's physical aspects to it. And, you have the challenges of, just people of a different era, a different generation having difficulty with some of those kind of considerations.
That's right. Because you have the barrier of communication because a lot of them may or may not speak English as their primary language, and then you've got, sometimes an older generation that may have some biases towards some minorities. So, there's just a lot to think about. And so I view my job as just laying this all out so families can make better decisions. The other thing is sometimes families will be like, well, I only need 1 or 2 hours a day of home care. Well, the reality is that because you can imagine the applicant pool is difficult to draw from, right? That's true. Yeah. Not everybody passes the criminal background check. Very few people pass the drug screen. So we have a very limited supply of quality applicants that then we can actually hire.
The expectation is going to be harder and harder as the elderly population grows. There's going to be more and more competition to find the people that are qualified and fit these criteria.
the quality people.
Yeah.
Yeah. And so because the home care industry, or it's not even just the home care, I think globally our problem is trying to find good help, right?
Yeah.
And so you can't just have a 1 or 2 hour shift. Most home care companies have a 3 or 4 hour minimum. Some of them have an 8 hour minimum.
And there's some understanding of that. People need to be compensated sufficiently they can't just be going 1 hour or 2 hour and make a, proper wage.
That's right. That's right. Because speaking of wage, that's the challenge with our healthcare industry. Their pay is very low. They're only making $12 to $15, $16, $17 an hour. You can't live very well on that. And so a lot of the home care workers have 2 different jobs, and so there's a high turnover rate because there's a high burnout rate. It is hard work.
Yeah.
One thing that we talk about with the aging plan is, and it's always a blessing when I can catch a family that's not in a crisis, because then we can talk more thoroughly. We can make better decisions because emotions aren't all over the place, right? They can concentrate and make smarter decisions. But it's challenging when families wait until they're in the midst of a crisis to figure out, okay, what are their options? Because the problem is often that they've never had a family meeting about, okay, what's the plan if dad has a stroke and mom's dementia gets worse? Do they have their living will? Do they have their power of attorney? Where is it? Who did they name as the power of attorney? Do they have long-term care insurance? What does it actually cover? Do they have life insurance?
What kind of resources do they have? Yeah,
that's right. Yeah. What do they have in place, and where are the gaps in their planning? And what I see, 99% of the time, it's that big of a problem. 99% of the time, families have had maybe bits and pieces of these conversations, but usually one of 2 things happens. They get so much pushback from their parents that they quit trying because they think mom and dad think they're probing and it's none of their business. Guess what? It ends up being your business when you're the adult daughter and you have to come to the rescue, and the hospital's asking you, well, what's their end of life wishes? And you're like, I don't know. Right.
Not the time to be having that conversation.
That's right. And unfortunately, that's where it often ends up happening. The other problem is that the parents want to, not only do they sometimes give the kids pushback, the kids usually want to have this information because they may have already had a medical crisis with their parent and they found out how ill prepared they really were. Mm-hmm. And so they're like, wow, we know that we're going to have another crisis. Let's be more prepared. And so, but the thing is that they don't know what questions to ask.
Well, I also think, too, it's hard to have those conversations perhaps in that setting when people are easily distracted or, if they're starting to undergo some of those challenges, it may not be as simple a process as you might expect. Annalee, I want to just quickly have you talk about compensation as well, because, many times people will say, well, we don't charge for our services. And obviously they're getting compensated. And so it's important just to have some clarity around the different business models in your line of work.
Yeah. So I'm glad you bring that up, because part of what I do is get the supports in place that we need right now because they're in crisis. So they might need home care. They might need to get their legal documents updated. But we also help families make informed decisions on which care communities would be a better fit for them based on what their level of care is, what their goals are, what the waiting list is, what the admission criteria is, and all that kind of stuff. So what you're talking about is these companies that are they're called placement companies. And I won't name them because I don't know that I can legally do that. But they're placement companies. And how they work is they don't charge the family. Their services are free. But
there were air quotes for those who are listening.
Yes, there were air quotes. There's air quotes for that. So they're free because how they're compensated is they get a kickback from the facility that you end up in. Okay, so you only, what that means is what I don't like about
they get some compensation indirectly from wherever they're placed. So there's a potential conflict of interest in the process of how's one being advised for where to go based on the compensation considerations as a potential risk. So
they're only going to send you to where they have contracts where they get a kickback.
How do you do that then?
So I'm fee for service. So my clients pay me, but then they know that their best interest is at heart in
the way you're doing it. I just think that's an important thing to delineate and point out. And I know we have limited time, so I wanted to just hit on that.
I want to make one more
right ahead. Go right ahead.
Two more points about the placement companies. There's zero planning. It is totally a transaction. So if they place you in facility A and you hate it, then it's too bad, and then that's when the family then retains me, because they're like, oh, we use this placement company and we hate it here. And then they hire me to do it right the next time. But the other thing to know is that they're only going to expose you or show you those facilities that they get that they have a contract with,
where there's compensation involved. Yeah.
And that doesn't mean that it's the right fit for you or your loved one. It just means that
now, where you're national, how do you know the different choices that are available? Do you engage local advisors as well, or, people in your industry?
Yeah, so I actually have a team of people that work for me. I have 12 employees, and we have a database as well, and we do the market research. So we find out when we do a community matrix project for our clients, because as you know, families just don't live near each other anymore. And if you've got dad in Arizona, mom in Texas, because they're divorced, and you've got 4 kids in 4 different states, it gets really overwhelming really quickly. And so most families have us do a community matrix for where they also live, that the adult children live, because you can't just keep flying back and forth. It's just not feasible. So what we do is we look at what is the waiting list, because sometimes our clients need to move sooner rather than later. What's their pre-admission criteria? One thing I want your listeners to know is that you can't just get into whichever care community you want to because you want to. You have to financially qualify. You have to fill out paperwork. You have to be approved. So you have to financially qualify, and it's not cheap.
And sometimes health is a factor.
That's right. You have to financially qualify, you have to cognitively qualify, and you have to medically qualify or physically qualify. And unfortunately, what happens is when families come to me, they're already so medically complex. They already blew through their money on home care, and so now their finances are limited.
All right. We were planning to spend more time on the next topic that I want to give you time to talk about, but we've only got like 2-3 minutes left. So
Oh, wow. Okay.
So we wanted to talk about the grab and go binder that you use as a really vital tool. Spend a few minutes just elaborating on what that is. Yeah. And perhaps, if people want to learn more about it, how they might pursue that. Okay?
Sure. Yep. So one thing I know from being a social worker for 25 years is, like I've already said, families just don't talk. They don't communicate about what they have in place and what they don't have in place. And so the way they find out what's in place is when there is a medical crisis. And again, the doctor needs the power of attorney or the living will, or your loved one died or didn't die yet, but the kids have to step in and become the financial POA, but they can't do anything at the bank or with a long-term care insurance policy because they need to have
authority. Yeah.
That's right. And so it becomes a mess. And so I developed the grab and go binder. It's 11 tabs. Right now it's still a actual physical 3-ring binder because I'm working with the tail end of seniors that like paper.
Yep.
But what those kids do is they scan all the documents and then they put it into their own little like Google Drive or whatever. But there's 11 tabs and it's emergency information, like who's your financial planner, who's your doctors, who's your long-term care insurance, who's your CPA, who are the people on your team that are your go-to people. What are your insurance coverages that you have? House insurance, car insurance, business insurance, all things
detail
insurance.
All those policy numbers and legal contact information.
And actual policies and legal. There's a legal tab, and behind each tab there's a checklist of suggested items to put in that particular section. Mm-hmm. I'm a business owner. There's a lot of business owners that, I have my business succession plan in there. Mm-hmm. I have all of my accounts and passwords for my business in there, my Zoom account, who I use for payroll processing, because if something happens to me, I need to, it would be awful to leave my family in a bind, not knowing any of this stuff, right? There's a funeral tab in there. There's an about me tab. So especially for people that, you should have a copy of your a picture of your parents in there, especially if there's dementia, because if they get out and lost, you need to have something to show the police officers. So there's 11 tabs in there, accounts, passwords, online accounts. So like I have a gazillion Delta points, Southwest points, because I used to travel a lot pre-COVID. Yep. And so those all count, because those are ways that you can actually leverage those points to help your kids defer some of that cost or cut some of that cost to them every time they have to fly down and stay. And so so when we have the family meeting and do the aging plan, we talk about all of these things. So it's not a quick process like, it's not like we're writing out a grocery list. We're putting this whole comprehensive plan. So it's a time-consuming process, and if you wait until you're in crisis, we have a lot to do in a short amount of time, and it does get overwhelming.
So plan ahead and plan early and often. Yeah. So with that, we are unfortunately out of time. This has been great, action-packed, lots of good content. I'd love to talk to you again. We'll have you back. But the grab and go binder, I'm going to take a look at this. I think I need to get it for me and perhaps for family members. So with regard to this, what's it cost and how do people go about pursuing that?
So you can get the grab and go binder. It's on my website at www.carerightinc.com, and right is spelled properly, RIGHT, inc.com. It's $150. It's a plug and play solution. It also works as a family meeting agenda item. So if you decide you want to have your own family meeting, each tab of the binder is your agenda, right? So, hey kids, this is what I have for a living will. This is what I have for insurance documents. So I tried to make it as user-friendly as possible. So each tab in the binder works as the family agenda item, if you know what I mean. But it also, you get on my grab and go binder database list for life. And so I continually add new content. So like right now I'm working on a pet section, because a lot of people have pets. And then when you're in a crisis, it happens to Fluffy.
Who's going to take care of them? Yeah.
That's right. And so right now I'm working on a pet section. So I email out, reminders 3 or 4 times a year. Hey, update your binder if you've had any changes or changed beneficiaries, if someone passed away or divorced or anything like that. So you can get that on the website, $150, and that includes shipping and handling. And one binder is not going to be enough if there's 2 of you. My binder, just for me, is bulging.
Yeah,
so
right.
If there's 2 of you, you're going to need your own binder.
All right. CareRightInc.com. Annalee Kruger, thanks so much for being with us.
Thank you for tuning in to the Care Right podcast. We hope today's discussion has provided you with valuable insights. If so, don't forget to like, subscribe, and share our podcast with others who might find it helpful. Remember, Care Right is more than just a podcast. It's a community dedicated to supporting family caregivers with comprehensive care planning, crisis management, and resources for every stage of aging. Stay connected with us for future episodes as we continue to explore essential topics in aging planning, elder care, and financial planning. Until next time, take care, plan wisely, and remember, you're not alone in your caregiving journey.